Okay, we're going to look at flexor hallucis brevis. Now, this, look, I know we get carried away with plantar fasciitis and all that sort of stuff, but in terms of dealing with athletes sometimes, especially with medial arch pain, flexor brevis is probably the one that once again goes under the radar. Really, it's an extraordinary muscle. Obviously, it's attaching here onto these the proximal phalanx of the big toe, comes all the way down here and attaches onto the cuboid muscle, actually, cuboid bone, sorry, I should say. So really important muscle, believe it or not. Yes, it occupies this portion of the medial arch. You tend to find a lot of clients that may be coming in with a navicular drop, which is not a great idea, especially for lower limb athletes. You'll probably tend that this muscle will be involved. The trigger points, where are they? That's a good question you ask. They can actually be littered anywhere along the length of this muscle, okay? So I don't necessarily say, oh, you know, at the close, you know, proximal to the attachment down here to the cuboid or up near the toe. It can be anywhere along there. So in that case, what I tend to do is, and this is the position I love treating this area, I'm going to come down with a loose fist, and obviously my emphasis is going to be on the medial arch through there, but specifically on that flexus hallucis brevis, and obviously bring it all the way down right onto the attachment to the cuboid, which is about here, okay? So we've got this really nice dense layer of tissue down through this here, okay? And I know we've got quadratus plantar there and so forth, but as I said, those clients are coming in with a navicular drop, and that may be related to their tibials and posterior as well. This is an area you want it definitely, because unfortunately as the foot hits the ground, they've got that little bit of a navicular drop. It'll actually spread and open up that flexor hallucis brevis so much more. So it puts more of a tensional load on it. So as it sort of hits the ground, it opens up just that little bit more. So make sure that you get on there, just work through that. And I tend to find this is really comfortable because it's a broad approach. It's not too difficult, is it, Dan? No. So try and keep it as broad as possible. Once you start getting in with your thumbs and doing this sort of work, that's when it starts to become really quite painful. And I'm not a massive fan of using your thumbs, as you well know, so that's just stupid. So just work through that tissue, take it all the way, okay, just from below the proximal phalanx, the big toe, through the bulk of the tissue, and then all the way up, okay? So what you can do sometimes, just every now and then, is just, if I bring this off just a little bit further here, what we can do, we can start to just sort of mobilise the big toe as we work through there as well, okay? Which is always going to be super beneficial for our lower limb athletes. And then you can just sort of mobilise, really stretch and open up that flexor hallucis brevis, okay? Alrighty, flexor hallucis brevis.